We stayed with developments in Delta State, where 4 cases of the Lassa fever were recorded, with 2 people dead and others recovering, as state government intensifies sensitization and advocacy. Commissioner for Health Joseph Onajeme, at a press briefing in Asaba, challenges residents to maintain clean environment and ensure food as adequately covered. Ikinamechi reports.
Lassa fever is a viral disease prevalent in West Africa, with Mastomys nethelensis, a rat species, serving as a primary reservoir. In Nigeria, annual outbreaks occur from December to March. In Delta, the cases this year has the lowest of 4, but unfortunately, 50% fatality has been recorded. Commissioner for Health gives more details.
And currently, we've done about 43 testing from day 1 to week 12, and 4 confirmed cases, 2 deaths so far recorded. We are doing a lot to ensure that we curtail the transmission from patients to our health workers, then from patients to relatives. Currently now, we are doing a lot of advocacy, especially to the health workers and Deltans, to have a high index of suspicion when they see those cases.
Dr. Mildred is a state epidemiologist, and she emphasized on preventive measures.
They were doing a lot of advocacy, a lot of sensitization, encouraging people to ensure that their food materials are kept covered so that they don't get contact with the rats, so they don't contract the disease in the first place. Another thing that we're doing, which we have done so much in this period that we've had cases across these 4 LGAs, to work very closely with the Ministry of Environment. We've been able to go to the homes of these people, and the places that we've looked at, we've seen that there's a bit of problem with environmental sanitation.
According to the Nigerian Center for Disease Control and Prevention, from January 1st to February 11, 2024, there were 411 confirmed cases, including 72 deaths of Lassa fever. Ikenna Amechi, TVC News, Asaba.
Professor Oyewale Tomoru is a professor of virology. He joins me live from Addis Ababa for more on this developing story. Thank you for joining us, Prof. This year alone, we understand that at least 24 states have recorded 1 confirmed case of viral hemorrhagic illness. How do you think Nigeria can be better prepared to tackle the outbreak of epidemics?
Thank you very much for Nifemi. I had the commissioner and the minister saying they are advocating. We started that advocacy too late. We should have started that in October, not January, not even March. We know, we have evidence, we know what happens in this country. Lassa fever starts around the dry season, October, November. That's when we should begin the advocacy, not when it has reached a peak now. Delta is not one of the states that have a lot of cases. We are talking of Edo, Ondo, Bauchi, Taraba. Those are the ones that have the big problems. So everyone, and all this idea about taking Deltans, people travel from all over the world. The disease is all over the country. So the advocacy is for the entire country, not for Deltas only. Because somebody can come from Lagos or come from Bauchi or Ondo to Delta carrying the disease. So it's not limiting to Delta. It's to the whole country that we should give advocacy. And advocacy should start at least 5-6 months ago, about October, to let our people know. We are reaching the peak now. We're now starting advocacy. There's the wrong time to start advocacy.
So we're here now. We understand that the virus is transmitted to humans through infected rodents. So what should Nigerians do differently now?
Basically, I mean, we've always known what to do. It's just that we won't do what we should do. That's all. We know it is like you said, like they said, the thing is Mastomys nethelensis. That's what is responsible for it, because that's a natural host. He sheds this virus in his urine, feces, and whatever. So when when the rat affects our food or comes into our houses and defecates and urinates, then they drop the virus, which if you soak gari and you don't cook it, of course you get the virus. If it enters into a fruit or something that you don't cook or boil, then that's where it happens. And sometimes, we dry some of our fruits along the road all over the whole place. The state of hygiene in Nigeria is a thing that we should really look at. There are other diseases, but Lassa is one of them.
But how fatal is this fever? Delta is reporting 2 deaths out of 4 cases. That's alarming, right?
Yeah, it is for Delta, but then you're only talking about 4 or 5 cases. In the entire country, it ranges between 12% to 20% of all the years. I mean, we have the figures from 2019 up to now. We're having the smallest figure we had was in 2019, when we were 533 confirmed cases. Since then, it has almost like it doubled to 1,000. We've been recording over 1,000 confirmed cases since 2019. There was a break in 2021 because of COVID. People were not coming, they were not reporting. But soon after we got back to our system, the number jumped back to what it was before, over 1,000 cases confirmed every year. And 18 to 20% of those people will die. The worst part of it is that, just like you said, doctors and health workers get infected because they treat all those people without knowing that even the awareness on their own side is even a person comes in with a febrile infection, fever, and it's bleeding, and you go straight and carry out surgery without doing infection and prevention control. Of course, our doctors will continue to die. And that's what is happening to us. That's only then we know that, Lassa is around. It's an annual event, so I don't see why we panic every year. We should have prepared, as I said, way back around October, November, and then we won't be where we are now.
Well, some people have been adapted. Hopefully, we'll act differently in the coming days. Professor of Virology, Professor Oyewale Tamari, thank you so much for talking to us.
It's my pleasure, Nifemi. Thank you.
Moving now to security stories, where the Minister of Defense, Abubakar Badaru, has delivered